Go. Hello everyone, my name is Dr. Gareth. I'm one of the consultants at Jacaranda Maternity, and this is another of the TikTok live videos that we do every month in order to have some questions asked about pregnancy and also to give general pregnancy education and information for any patients who are with us. This TikTok is slightly different because we are also being joined today by partners from Textbook Centre and Rafiki Bank who are here to see the kind of work that we do, and we have a few topics that have been requested by people from our partners who just have some particular questions about pregnancy. So there's 4 topics that we'll cover in this talk and have a quick chat about different things, but at the same time you're welcome to send in your questions, particularly if they're about what I'm talking about, if you want any clarification. So the 4 topics we said we talk about today are family planning, miscarriage and ectopic pregnancy, as well as pregnancy journey, and then ending with a little talk about preeclampsia, which is something we talked about on a previous video. So we'll get started with these little topics, but at the same time, if you find that you have any questions, just try and send them in and we will try and get your questions answered as well. So first of all, talking about family planning, obviously the best way to avoid any problems in pregnancy is not to be pregnant. And so for many women, family planning is a really good idea so that you can schedule your pregnancies to the time in your life that suit you. There's a bit of a rumour or a bit of a myth going around about family planning, that sometimes people think they can only have family planning once they've had a baby. That's not true. So when it comes to family planning, there are different kinds that you can use, and they're all very, very safe as soon as you are an adult, or as soon as that you're having regular periods and you're having sexual intercourse, then it is obviously possible to get pregnant. And so family planning can be used from a young age in order to make sure that you don't have an unintended pregnancy. So there are basically 4 different methods of family planning that you can use. So the first is the combined oral contraceptive pill. Now I'm specifically talking about female-related family planning here. So there's the combined oral contraceptive pill. These are things like microgynon and Yasmin and Dianet and things like this. So basically these are pills that you would take them every day. And you must never be a late restarter, so you must always remember to take your pills every day. So put them next to your toothbrush, and when you brush your teeth, then you take your pill. And so basically, with the combined pill, it contains estrogen and progesterone. Those are the 2 main female hormones, and because it contains both, we call it a combined pill. Now this pill, inside a box there's 28 tablets, and so inside that box there are 21 active tablets, and the other tablets don't contain any hormone, but the point is there's 28 tablets so that you remember to take it every day throughout the month, and then just restart the next pack. The combined pill is a really good option, and it's something that is good if you can remember to take it every day. The combined pill has lots of different combinations of the hormone. So everyone contains the same kind of estrogen hormone, but there are many different kinds of progesterone hormones. And so when women come to me and say, I want family planning, but I also have some problems with bloating or acne, all these sort of things, there are certain pills that you should give for women that have certain symptoms. So when you're having your period every month, it might be that pain is a big problem for you, or it might be that bleeding is a problem, or it might be bloating, or it might be breast tenderness, or any of these sort of things that happen to you every month when you're on your period, and there's a specific pill for each kind of main problem that you have. So for instance, if bloating and breast tenderness is a big problem for you every month with your period, you can try Yasmin. Yasmin contains a kind of progesterone called rosperenone, and that causes fluid, it causes you to pee a little bit more so you don't get so bloated. And then if you have skin problems, then Dianet is a great form of the pill as well. So there's lots of different kinds of combined pill, and they're really good. And the other advantage of a combined pill is tricycling your packs. So what that can mean is, let's say you're due to be on your period when you're going away to the coast for the week, and you don't want to be on your period while you're on holiday, you can just take the 7 tablets that are just non-hormone tablets, throw those away and start your next pack so you can time your periods to when you want them. So they're a really good option. Then there's the progesterone-only pill. So for some women, they may have some medical problems that mean the combined pill is not the right pill for them. So some things like if you have a strong family history of breast cancer, then maybe the combined pill is not the right pill for you. Or maybe in the past you might have had a blood clot in your leg, you might have had a DVT. So again, the combined pill is maybe not the best one for you. So then there's the progesterone-only pill. And the progesterone-only pill doesn't really increase the chance of any of those things happening. It's also very good, but it's got a very, very narrow window. So that's something you need to know. So if you're on Microlute or one of the progesterone-only pills, you need to know that you must take it at the same time every day, because just a few hours difference can mean that you ovulate. And obviously, if you ovulate, you can get pregnant. So if you're a very, very organized person, very rigid, then the progesterone-only pill might be the one for you as well. Then the next forms of family planning are the implants and the depots. So basically the progesterone-only pill is a form, but there's also another thing which is just like that, except you can have it as an injection every 3 months, and we call that a depot, or you can have it as an implant. So the implant goes underneath your skin and it lasts up to 5 years. Now the advantage of these things is you don't have to remember to take the pill, which is great, and they're really, really good. But the problem with the implant is some people, about 10% of people that have the implant or the depot, really don't like it. So I always advise people, if they're thinking about it, that they have the depot first, because it only lasts 3 months, to see if they like it. And then if they have the depot and they're fine and they have no problems, then they can switch later to the implant, because that's great. And it's very, very unpredictable. And with many kinds of family planning, there's a bit of trial and error. So what it means is that, one woman might really, when she has the depot injection, have changes in her mood. She might feel upset more, or this sort of thing, because the hormone effects are causing an imbalance that make things a bit more stressful, or these sort of things. So the depot injection and the implant can have some side effects. And there's also this thing that people talk to me about a lot when it comes to the depot and implants is, do they cause weight gain? And I think that's true again of about 1 in 10 women. For 1 in 10 women that have the depot or the implant, the average weight gain that they get is something like 1 to 2% of weight gain. So again, you may be the kind of person that tries it, you don't put any weight on, you feel fine on it, and it's fantastic because you never have to think about the taking pills, which is great. And then the final type of family planning, which is very good, is the coil. Now, the coil is a little device which is made of plastic that goes inside the womb, and that requires you to come to see a gynaecologist or a midwife who does a speculum exam, a bit like having a smear test, and then they just pop the little thing inside the cervix. Now, the disadvantage of the coil is that having that done is a bit invasive. People don't tend to like going to the gynecologist for some reason. But when the coil goes inside, it's a bit uncomfortable just as it's going in. But once it's in, then it's fine. And again, they last between 5 and 10 years. They're brilliant forms of family planning, particularly if you've completed your family. So let's say you've had 3 children and you don't want to have any more children, then having a method of family planning that lasts 10 years is fantastic. And so this coil goes inside. There are two main kinds of coil. Now there's the copper coil. The copper coil is very effective. Basically, the way it works is that copper is toxic to sperm. So when the coil goes inside, it just stops any fertilization occurring, and it also prevents the egg from implanting in the womb properly. So the copper coil is good. Some people that have the copper coil say that it makes their periods heavier, and so when they've got it, they're bleeding a bit more every month. But for most people, that's manageable. It's maybe an extra pad. It's not too much more. But for some people, when they have the copper coil, it can make their periods very heavy. Then the other kind of coil is the hormone coil, and there are different companies that make hormone coils. So there's Mirena coils, and there's Avibella and Levocert, and they're all the same thing. But basically, with these coils, people hear the word hormone coil and go, oh, I don't want that because it's got hormones in it. But actually, the great thing about these kind of coils is that the hormone amount is so very small, it's largely just released on the inside of the womb. So it doesn't really get into your bloodstream. Something like 0.01% gets into your bloodstream. So it doesn't really have any of those side effects that some people worry about with the implant or the depot or the progesterone-only pill. It doesn't cause weight gain or these sort of things. So these hormone coils are really quite good, and there's lots of advantages to them. They actually make your periods lighter. We use them for people that have really heavy periods. So if a woman comes and says, I have awful periods and they stop me going to work and it's really bad, then the Mirena coil is a really good solution to that, because it makes your periods much, much lighter and much more manageable. They are more expensive than the copper coils. The copper coils are relatively cheap, but the Mirena coils on average, I think at the moment, cost about 8,000 or 9,000 shillings to buy one. They are a good investment, in my opinion. That they do really help people not get pregnant, and at the same time they make their periods a bit lighter, so it's kind of a great thing. So it's kind of a worthy investment as well. So those are the things around family planning. So that your options are the pill, the coil, the implants, or the progesterone-only pill. The things you need to know about all of these is that they are reversible. So if you take them out, or you decide 2 years after having them, I want to get pregnant, you can stop taking them, or you can have the coil removed or the implant removed. And within a few months after you've had that, your periods will return to the way they were before you started using the medication. Now, this is also something important that people say about family planning. That they say, oh, I was on family planning and then I came off it and I can't get pregnant. But the explanation of this is that family planning does not cause any fertility problems when you stop it. So sometimes what might happen is you might meet a woman who was having a fertility problem before. So let's say she started family planning when she was 23, and she didn't want to get pregnant at that time. She had a career. But before she started the family planning, she was having irregular periods. Then, when she was on the family planning, the periods became regular, because that's how family planning works. And then afterwards, when she stopped it, her periods went back to the way they were before she started the family planning. And so then when she has difficulty getting pregnant, she says it's family planning's fault. But that is not true. Some women have difficulty conceiving that is throughout their whole life, but it's not related to the family planning. So if you're thinking about family planning but you're worried that it's going to have an impact on your fertility, the true answer is it does not change your fertility at all. So these are the different things about family planning. So I think that's our first topic. Oh, the other thing I want to say about family planning is that condoms are effective, but they are not as effective as all the other things we talked about. So, you know, condoms, using cycle methods, safe days, all these things help you not to get pregnant a bit, but generally condoms fail, they break, and then sometimes you have a funny ovulation where you think you're following safe day rules, but actually you ovulate early, and these sort of things. So they're nowhere near as effective as the other things we talked about, which is the pills, the depots, and the implant. And then obviously the final thing is with family planning, you can also have permanent family planning. So permanent family planning can be a woman has a tubal ligation, which is an operation to block the tubes so that they don't get pregnant again. And there's also vasectomy. So men, once a family is complete and the husband and wife do not want to have any more children, the man can go for a vasectomy as well. The vasectomy is a much safer, easier and more successful operation than the woman having the tubal ligation. Tubal ligation is much more dangerous. So generally speaking, I would say vasectomy is a great way for a family not to have children if they are complete. Okay, so that's family planning discussed. I don't know if we have any questions now about family planning. I can answer a few questions or anything we have so far. Wow, we might not get through all these topics, you know. Okay. All right, so now we're moving away from what we were talking about, and we're just going to answer some general pregnancy questions. So the first question is a bit of a sad one. Basically, there was the story is that a woman started off with a twin pregnancy, but unfortunately, one of the twins stopped growing or didn't survive through the pregnancy, but the other twin was okay. And it says, why does this happen? So this happens quite a lot with twin pregnancies, that on the first scan you see that you have two twins, and then on the next scan you can only see one. Basically, when you get pregnant, we'll talk about this a bit later when we come to miscarriage, the sperm and the egg come together, and there are 23 chromosomes from dad and 23 from mum, and they all have to align perfectly in order for the pregnancy to be successful. So it might have been that what happened was that you had non-identical twins, and one of the twins had the normal genetic structure and the other one did not, and so that pregnancy did not continue. That's one reason. Sometimes you can have a situation as well where the twins are identical, sharing a placenta, and one of the twins shunts more of the blood in that direction, so the other one doesn't grow, and so that pregnancy fails. But usually it's the first one, that there's one of the twins doesn't have the perfect genetic alignment. The next question is, I was told I have an anterior fibroid while pregnant, now the baby is 7 months. Using microlute pill is okay? Okay, so obviously if you're pregnant you shouldn't be using microlute. Microlute is a progesterone only thing. Generally, if you prescribe progesterones in pregnancy, we use a different kind called Sustain or Dufastone. But generally speaking, if you have fibroids, this is a general thing about fibroids, if you have fibroids and you want to use family planning, then it is okay to use the pills, like the progesterone only pill and the contraceptive pill, the combined pill. It does sometimes, because fibroids are hormone sensitive, they tend to respond more to estrogen, and so they can enlarge based on the fact that you're taking those pills. But generally what happens is when you're taking the combined oral contraceptive pill, you are suppressing your regular ovarian function so that you don't ovulate. So generally speaking, it sort of balances out. It is okay to take the pill if you have a fibroid. The next thing, okay, so hi doc, would you help? I used the depot for 2 years and I stopped it in November and it's now 5 months and I am not pregnant. Okay, so there's a few things to say here. When you've been on the depot or the implant, when you come off it, it can take about 3 to 4 months for your periods to come back to normal. So that is quite normal. So if you're planning a pregnancy, wanting to start getting pregnant in July, and you have the depot, you can come off it maybe in like March, so that by the time you get to July, your periods are back to normal. So the question for this lady who sent this message is, are your periods back to normal? If your periods are back to normal, then that's good. But it means, and you said it's been 5 months and I'm not pregnant. There's a big expectation of people that the moment they decide that they're going to get pregnant, okay, so now it's April, I'm going to have a pregnancy, you expect the next month to be pregnant. But that's not how human beings work. Human beings take quite a long time to get pregnant. So if you've come off the depot and your periods are regular, we advise people to try to get pregnant over the course of 1 year. And in 1 year, couples having regular intercourse, trying to get pregnant, that takes about 85% and 90% of people will get pregnant if they have unprotected sex for at least 1 year. But the fact that it's only been 5 months, and because you came off the depot, your periods probably only came back to normal about 2 months ago, means that really you've only been trying for 2 months. So I would say that there's nothing wrong right now. As long as you're having periods every month, your fertility is probably okay. I would continue trying to get pregnant for the rest of the year. And if by January next year you're not pregnant, come and see a gynaecologist and we can do some tests to see what's happening. But many times when you come to see the gynaecologist when you haven't been pregnant for 3 months of trying, I usually say, okay, go away and come back in a few months. Doc, this is an easy question. Hi doc, I'm 3 months after a cesarean section and I want to have the coil. Is it safe to do? Yes. That was quick. Yes, you can have the coil 3 months after cesarean. You can actually have it 6 weeks after cesarean. Hi doc, is it normal to have cramps after a C-section and back pain? Yes, it is normal to have some pain after a C-section. It's also normal to have pain after the baby is born. So even if you deliver your baby normal, what happens is, when you're pregnant, you have a really big womb. But your womb, when you're not pregnant, is smaller than the size of a fist. It's really very small. So your womb has to go back to the size that it was before. So we call these after pains. That after the baby's born, the womb is shrinking down, and sometimes that causes cramping pains. The answer is ibuprofen. Okay, ibuprofen, if you're not allergic to ibuprofen, is a really good A really good pain thing for helping cramps, a really good painkiller for cramps. So paracetamol together with ibuprofen, taken with food, is a really good way to help those after pains. Okay, and now it says, okay, so kindly explain more on the implant and the effects after removing, and can one have it immediately inserted after removal? Yes, you can. If you've had it for 5 years, it can be taken out and you can put it back in. There are many things. It's concerning from a medical point of view. Sometimes women think about things like pill breaks or implant breaks, where they say, I'm on the pill, but what I want to do is stop it for a few months just to have a break and then come back on it. That is not based in any kind of logic or science. It doesn't make sense to take pill breaks, yeah? And the same is true with the implant. If your implant is due for removal, you can remove it and you can implant a new one as well. That's absolutely fine. Basically, the implant contains something called levonorgestrel, just goes under your skin, and it's inserted by a nurse, and then it just works perfectly. It's a very good thing. There are some other associated side effects of having an implant. There are some studies that link it to an increase in ovarian cysts and things like this, but generally speaking, they're not clinically relevant. So the implant is a good option for you. I would say if it was me and I wanted family planning and I was a woman, I would be willing to give it a go and say, let's see how it goes, but I would be of the understanding that having the implant, some people are fine with it and some people are not. So try it, and then if you don't like it, you can have it removed. Or try the depot first and see how you go with that, or the pill. Yeah, but generally when it comes to the implant, you can change them immediately. You don't have to wait. So that's some of the questions, and now we're going to move back to the next topic that we were going to talk about, which was about miscarriage and ectopic pregnancy. So miscarriage is a fact of life. It's very sad that it happens for people who are really trying to get pregnant, and then they have a miscarriage. Basically what happens with a miscarriage is, on average, if you took the average woman anywhere between the age of like maybe 20 and 40 years old, the average chance that a woman will have a miscarriage when she gets pregnant is about 1 in 6. So in a strange way, when you get pregnant, anytime a woman gets pregnant, it's like picking up a dice. And when you roll the dice, if you roll a 1, 2, 3, 4, or 5, then the pregnancy will stick. But if you roll a number 6, then the pregnancy will not get past a certain point. So what happens when you get pregnant is that the sperm and the egg come together, and the sperm contains DNA and the egg contains DNA. And they contain 23 chromosomes. So chromosomes are sets of DNA. So you have 23 chromosomes from dad and 23 chromosomes from mum. And what happens is that when the sperm and the egg come together, 1 must link to 1, 2 to 2, 3 to 3, 4 to 4, 5 to 5, and so on. But sometimes what happens is that chromosome 4 will link to chromosome 7 instead. And that means that all the genetic material is there, but the pregnancy can start, but it can't get past a certain point. And we call this a miscarriage. Sometimes you hear the word blighted ovum as well, which I think is a horrible term for it. But generally speaking, it's very, very common. Human beings are genetically very complicated compared to other animals. And so we are not like cats and dogs. We can only usually grow 1, maybe 2 babies. And fertility for us as a species is more complicated. And so miscarriages can occur quite commonly. So the first thing you need to know if you're pregnant is that, when was my last period? You always want to know exactly when your last period was when you're pregnant, because you're going to get asked that question a lot. And then also, if you do get to 6 or 7 weeks after your pregnancy and then you start having pain and bleeding, it's a good idea to come to see the gynaecologist. Because what happens is that if you do have pain and bleeding, then it's called what we call a threatened miscarriage. So that doesn't mean you're definitely having a miscarriage. It means that that it's possible that you are. And so you need to come for a scan and check what's happening and see the doctor to talk about what medications we might be able to give you, depending on what your scan says. So generally speaking, miscarriage is a common thing. There's certain things that make it more likely. So, smoking cigarettes, that makes it more likely that you'll have a miscarriage. Obviously, taking any hard drugs like cocaine is a really bad idea in pregnancy. That increases the chance of miscarriage. Alcohol does too. But the main risk is to do with things like weight and age. So if you're very, very, very overweight, that increases the chance of miscarriage. And also age. Age is a big factor that when it comes to the chance of miscarriage. I think people get very worried when they're getting close to the age of 40 and they're like, oh gosh, I need to have a baby now because I might have a problem. So the truth is once you get to the age of about 42 years old, then if you do get pregnant, the chance of miscarriage is no longer 1 in 6, it's 1 in 2. So it's 50-50. If you get pregnant when you're about 42 years old, it's 50-50 in terms of whether you may or may not have a miscarriage or not. And that's again because of this genetic problem that occurs. That doesn't mean there's anything wrong with you. It doesn't mean that you have a genetic problem yourself. It's just some of the eggs or some of the sperm have this slight genetic problem, which means you end up having a miscarriage. That doesn't mean it will happen again. Your chances remain the same. Okay, so generally it's a good idea if you're planning to get pregnant to have your first baby before you turn 40, in order to reduce those chances. But your fertility, I really want to explain this because people come with lots of worry. Is when it comes to your fertility is basically the same between the ages of about 16 and 32 or 33. Then from 33 to 40 there's a slight decrease in your fertility, but only by a few percent. And then it's after the age of 40 that your fertility starts going down. So if you're 38 years old right now thinking, oh, I can never have a baby, that's not true. Okay, so you can come and see us and we can have a chat about it, but generally speaking it's okay. Miscarriage is one thing, ectopic is another. Ectopic is when the pregnancy is inside the fallopian tube usually. So you have your womb in the middle, and then you have your ovaries on both sides, and then you have your fallopian tube in the middle. The fallopian tubes are in between the ovaries and the womb. And what happens with an ectopic pregnancy, and it occurs in 1 in 100 pregnancies, is when the sperm and the egg meet. They usually meet in the fallopian tube, and then once they meet inside the fallopian tube, the tube pushes the fertilized egg into the womb so the pregnancy can begin. But sometimes that mechanism fails, and so then you can get the pregnancy forming in the tube. Now the womb is about the size of a fist, like I say, and it can stretch. But the fallopian tube is very, very small, only about 1 centimeter in size. And so if the pregnancy forms inside there, it will grow, but the tube can only go to about 6 weeks. And then after 6 weeks, once it gets to that size, it'll start causing pain and then it can burst. And if the fallopian tubes burst, you're in a bit of trouble because they have a very strong blood supply. So ectopic pregnancy is something that doesn't happen to every woman. It's quite rare, only 1 in 100 chance. But at the same time, if you imagine how many people get pregnant in Nairobi every day, that means there are a lot of ectopic pregnancies, women with ectopic pregnancies right now in Nairobi who don't know that they have an ectopic pregnancy. So what should you look out for? If you're pregnant or your partner's pregnant or you're thinking maybe I have a problem, with an ectopic pregnancy, you get pain in the tummy first, and the pain is lower in the abdomen, and it's usually on one side because you have these 2 tubes, the left tube and the right tube. So if the tube has got the ectopic in on the left, you'll get left-sided pain. If it's on the right, you'll have right-sided pain. And it's very, very intense. Like there's strong pain on one side of your abdomen, on your pelvis, when you're pregnant. So that should make you think, oh, maybe I should see a doctor if I've got pain specifically on one side. Also bleeding, as the tube is stretching, blood can fall into the womb and then come out through the vagina, so you can get bleeding. And then if it ruptures, you can be very, very sick. You'll know when it's ruptured. The pain is very intense. You feel very dizzy because you're losing blood inside, because you're bleeding inside. And then sometimes you can get pain in your shoulder. It's a strange thing, but when a woman has pain in her shoulder, ever, you would worry a little bit about an ectopic pregnancy because the blood, as it's inside your tummy, starts irritating the upper structures in the abdomen, which are linked to the shoulders, so you get pain in your shoulders. And also sometimes it can give you diarrhea as well because the bleeding inside causes the bowel to spasm too. So ectopic pregnancy, I wouldn't spend a lot of time thinking about it or worrying about it if you're pregnant, particularly if you're after the first trimester. If you're past 12 weeks, you can't have an ectopic pregnancy. But generally, if you're in the first few weeks of pregnancy, you've just had the positive pregnancy test, you're like, ooh, I'm pregnant, and then you find you're having pain and bleeding all on one side, you need to come to the hospital because it's very, very serious. It can be a life-threatening emergency, so you need to come to the hospital. Ectopics are increased if you've had an ectopic before. So if you ever had an ectopic before, and you're pregnant again, you're going to want to come to the doctor early before anything happens, so we can check the pregnancies in the right place the next time. Also, sexual health is a problem for women that have sexual infections. If they catch a sexual infection from a partner or a man, what can happen is that those infections can scar your tubes, which can increase the chance of having an ectopic pregnancy. So those are the things about miscarriage and ectopic pregnancy. I'm not sure if you have any questions on those things or anything else. So many questions. Okay, so what are the necessary tests I should do after an ectopic pregnancy? So the first thing you should do if you have an ectopic pregnancy or a miscarriage is 3 weeks after the pregnancy has ended, either because the ectopic pregnancy has gone or you've had an operation to remove it, or you've had a miscarriage and the bleeding has stopped. 3 weeks after that time, you should do a pregnancy test. Okay, so doing a pregnancy test will let you know that everything is complete, because sometimes what can happen is pregnancy tissue can stay inside, and so you can then still have the pregnancy tissue inside from a miscarriage or an ectopic. So just make sure you do a pregnancy test a few weeks after the pregnancy is finished, so you know that that pregnancy event is over. You do not want to be having sex during those 3 weeks, because if you get pregnant again, it's difficult to know if it's a new pregnancy or if it's part of the old pregnancy. In terms of tests after an ectopic, you don't have to do too many tests. I would say that if you have any concerns about altered discharge, so if you're having any vaginal discharge that's a bit unusual, or having fevers, lower abdominal pain, these sort of things, it's a good idea for everyone to get a sexual health test at some point. So a sexual health test is a good idea. But generally speaking, you don't have to do any special tests after an ectopic. You just need to wait a few months after, make sure your pregnancy test is negative after the surgery, and then you're able to try and get pregnant again. But come to the doctor early if you've had an ectopic pregnancy before. The follow-up question to that is, I had an ectopic 1 year ago and I want to get pregnant. That's okay. You've waited a fair enough time after your surgery. If you want to get pregnant, then it's very okay to try 1 year after an ectopic. Don't forget, when you're trying to get pregnant actively, it's a good idea to take those pregnancy vitamins early. Okay, so when you're trying to get pregnant, get hold of some pre-pregnancy vitamins. Take those, because those can really help you in terms of having a normal pregnancy. It says here, I'm 31 weeks pregnant, but my baby is no longer active like before. Should I be worried? You should be checked. Yeah. So if you're ever pregnant, your movements usually tend to start about 20 weeks when you're pregnant, and you should be feeling kicks every day. If you're not feeling the kicks properly, then it's very important you come to hospital and have what's called a CTG. A CTG is a heartbeat test where we check the baby's heartbeat to make sure the baby's okay. Most of the time, the baby will be fine. So don't be worried, just come and get checked, yeah? But sometimes if the baby's not moving, then there can be a problem with the placenta or something like this. So we need to come and check, do a CTG, maybe a scan, see what's happening and make sure the baby's fine. And then, I believe they call it Sod's Law. Many times what will happen is you'll be at home and your baby won't be moving, and you'll be like, oh, I'm worried, I'm going to go to the hospital. You go to the hospital, and as you're sitting in the waiting room waiting to see the doctor, the baby starts kicking like crazy. That happens, yeah? But the point is that if the only way we know if the baby's well is if you come and check. So if you're unhappy with the baby's movements, you must come and check. Hi doc, I'm 39 weeks pregnant and I've been vomiting and having headaches. What could be the problem? So if you're vomiting at the end of the pregnancy, that's not typically normal. And if you're having headaches as well, that's also not normal. So if you're vomiting and having headaches at the end of the pregnancy, you definitely need to come to the hospital to check your blood pressure and make sure you're okay. In terms of reasons why these things happen, sometimes when you're in the beginning of early labor, for some reason when God created the woman's body, they connected a nerve from the womb to the stomach. So there's a shared nerve linkage. And so sometimes when your womb is contracting, your stomach contracts too, so that makes you vomit, which is not very nice. But it is how it is. So it could be that. If you're having headaches as well, though, it could be that you're having a blood pressure problem, so you need to see someone then. It could obviously be food poisoning or something like this as well. So again, see a doctor. And then finally, very rarely, there's very, very, very rarely. Sometimes if a person's vomiting a lot at the end of the pregnancy, it can be because they have a problem with their liver. So sometimes we do liver tests to check your liver's okay. I'm 36 weeks, but I have not taken deworming tablets. Should I go ahead and take them? Yeah, it's fine. You can take the deworming tablets after 20 weeks. Okay, so it's okay to take the deworming tablets. Can I have a natural birth at 42 weeks for the first baby? Yes, but you should not be at 42 weeks. In Kenya, the guidelines say you should deliver your baby at 41 weeks at the latest. So if you're 42 weeks pregnant right now, and you are still pregnant, then you are overdue. So you need to come to the hospital as soon as possible, because we need to get this baby to be delivered. But yes, you can deliver your baby normally at 42 weeks. What precautions can I take? I am pregnant and diabetic. I'm not advertising my services here, but I am a diabetes specialist in pregnancy. So what the answer to your question is, if you're a pre-existing diabetic and you're pregnant, please come to the hospital. I don't know which branch you are, but you can reach out to our maternity team here. Different doctors do different things. So some people are specialists in cancer, some are specialists in scanning. I'm a specialist in maternal medicine and diabetes. So if you're a diabetic woman and you're pregnant, please come and find me, because there are many, many things we have to talk about. Right then, so the next thing is pregnancy journey. So we're going to quickly talk now, just for 5 minutes. This is a big, intense TikTok today, so many things we're talking about, but basically pregnancy journey. If you're not pregnant right now and you're thinking, oh, I might get pregnant soon, and your questions are, what will happen when that happens? So generally, the pregnancy journey begins before you start getting pregnant. The first thing you need to do is make sure you're in really good health before you try and get pregnant. So if you have a medical problem, like you're diabetic, or you know that you've got really bad asthma, or you know that you've got liver problems, or HIV, or whatever it is that you're living with in your day-to-day life, and you think, okay, I'm going to have a baby, it's a good idea to come and see a gynaecologist beforehand to make sure that everything is stable before you get pregnant. If you don't have any medical problems, or you do have any medical problems, and you're thinking about getting pregnant, one of the things you should do is buy one of the pregnancy supplements. Yeah, so these pregnancy vitamins, like Pregnicare, Pregaday, Preganine, you can buy those things. And basically you want to take those while you're trying to get pregnant, because when you're pregnant, sometimes people may be missing a vitamin, or they don't have enough selenium, or they don't have enough of the regular vitamins you need in order to grow a healthy baby. And so what can happen is babies can be born with some particular birth problems, particularly if you don't have enough folic acid. Folic acid is something you might have heard of before in pregnancy. And it's really very important that you have good folic acid levels before you get pregnant, because if you don't do that, sometimes babies can have deformities because of your low folic acid levels. So we usually advise people to take those pregnancy vitamins. The moment you get pregnant, congratulations, as we talked about before, any pregnancy has about a 1 in 6 chance that you might have a miscarriage. So typically people don't tell everyone straight away. The day you get a positive pregnancy test, you don't put it on Facebook, you don't put it on Instagram, you don't tell everyone, because the point is there is that 1 in 6 chance that the pregnancy is there, but the genetic material is not aligned, and so you may have a miscarriage. But usually in the first 2 months of pregnancy, if you're okay, and you don't have bleeding or pain and everything's fine, then you know that your pregnancy is ongoing. Don't forget that really important thing. Every doctor, midwife, every person that meets you will say, when was your last period? So the moment you have a positive pregnancy test, think back, when was the first day of my last period? Write that down, because you're going to be asked it about 50 times during your pregnancy. And many times if you don't do that, then you get to about 2 months in and you're like, oh, when was my period? I'm not sure. So you want to try and make sure you know when that is. So you will continue taking your pregnancy vitamins for the first few months of the pregnancy. If you're feeling well and everything's okay, you can wait for about 2 months after the pregnancy test is positive. And then usually you want to come to find a midwife or a doctor at that time and say, okay, I think I'm about 2 months pregnant, I'm feeling okay, everything's fine, what do I do? And so then what will happen at Jacaranda, if you come here, is we will book your pregnancy. What this means is that you'll come and sit with a midwife, and then we have a big computer system here, and we go through all of your medical history, all of your surgical history, find everything about you, if you smoke cigarettes, what you do for a job, everything that we need to know about you, and then we put that into our computer system, so if you have any problems in the pregnancy, our doctors can instantly go into the computer and be like, all right, okay, so this is Mary, she's 36 years old, and we know everything about you just in case there's any problems. So you come and book your pregnancy, that's the first thing. And then you have what's called an antenatal profile. This is where we do blood tests to find out what your blood group is, find out what your iron levels are in your blood, because that's very important. Babies like iron, so you want to have good iron levels. And then also to check for certain diseases, because there are certain infections that people can have without knowing that can affect the pregnancy. So those are things like HIV and hepatitis B and syphilis, things like this. So people sometimes don't know they have those problems. So we check for those things. And then at some point in the next few weeks after that, you'll have what's called a dating scan. This scan is done to check the baby's due date, because we can have your periods as what we think your periods are, but actually it's the scan that's done between about 10 weeks and 14 weeks that really lets us know exactly what your due date is, because all babies are the same size between 10 and 14 weeks, so when we measure babies at that time, we know exactly when the due date is. Many times we meet women who come to us for the first time, they've had no pregnancy care at 22 weeks, 23 weeks, and at that point, since that's the only time we can scan them, we're kind of guessing what the due date is. So it's really important if you're pregnant that you come in the early part of the pregnancy so we can do a scan. And then we know when you're pregnant. And then basically there's lots and lots of things you do. If you're having a normal pregnancy journey, the next thing at Jacaranda is you'll see an appointment for a midwife about 18 to 20 weeks, and we take you through all the preparation, diet, nutrition, make sure you're doing everything okay, make sure you're not eating the wrong things or doing too much exercise or whatever it is. And at that point you get what's called deworming. So there is a high incidence of certain infections that people can have that they don't know that they have in their bowel. And those infections can cause you to stop absorbing iron. And like I say, in pregnancy, you really need iron. So we give everyone this tablet at 20 weeks to make sure they're okay. Another thing we always do in pregnancy is check what your tetanus status is, because tetanus is a bacteria that's very toxic in pregnancy. So we can give you vaccines for that as well, to make sure you don't get that. And then around about 24 weeks, so you're now about 6 months into your pregnancy, you're getting to that time, you're like, oh, wait, having a baby soon, you need to come and see a doctor for the first time. So if you have no medical problems and your pregnancy is very straightforward, the first time you'll meet a doctor is about 24 weeks, and we do what's called a GTT test, because in pregnancy, 1 in 20 women can get pregnancy diabetes. And so what we do is we test everyone at 24 to 28 weeks to see whether you might have pregnancy diabetes, because if you do have it, we need to control it. And if you don't have it, that's great. But if you do have it, we need to talk about controlling it, because if you forget about it and ignore it, you can end up with some serious complications at the end of your pregnancy. So then you'll meet the doctor will check everything, make sure all of your scans are fine, make sure everything's good, and then you'll be going through into the 3rd trimester. So we split pregnancy into the 1st trimester, 2nd and 3rd. So the end of the pregnancy is called the 3rd trimester, and at that point you'll be seeing midwives more regularly, checking that the baby's okay, checking your blood pressure's okay, checking for urine symptoms, all these sort of things, and making sure things are fine. At some point in the 3rd trimester at Jacaranda, you're invited to come to birth preparedness class. So if you've never had a baby before, or you've had a baby before and you just want to go, we have a birth preparedness class where it's run by a midwife, dietitian, nutritionist, to talk to you about what it's going to be like having a baby, the different options, talking about what would happen if you ended up having a cesarean section, talking about breastfeeding your baby, talking about the first few months of looking after a baby. So it gives you that kind of education, and it's like I think it's like a 5 or 6 hour morning into the afternoon session where you come and we just give you some support in terms of helping you have your first baby. And then towards the end of the pregnancy, we'll be seeing you more regularly, and then at any time after 37 weeks you might go into labour, and then you'd come to the hospital and we'd help you deliver your baby. Sometimes you get to your due date and your baby's not here. You're like, where is this baby? And so sometimes what we do then is talk about induction of labour. You'll meet a doctor and we talk about different ways of delivering a baby. But that's your general pregnancy journey. But obviously it changes. You know, if you have medical problems or you've had multiple surgeries in the past or something that's very special about you, then you may see the doctor more regularly to make sure your pregnancy is going well and these sort of things. So I think that's our 3rd topic. So maybe some more questions and then we'll go on to the last topic. And then I think we are done. Is this just the one question? Just this one question. Great. Okay. I gave birth normally a month ago and had stitches. I've been having some pain in the stitches. Okay, so if you're having a lot of pain in the stitches after you've had a vaginal birth, sometimes you have some stitches. then come and have a chat with us and make sure that there's no infection, because sometimes the stitches can get infected. It's quite rare that that happens, but we need to make sure that's okay. The main thing after having a baby is that if you've had stitches but you're having difficulty going to the toilet, or you're having some problems with controlling your bladder or bowel or something like this, then that's a good idea to come to the doctor. There are lots of painkillers that are safe to take while you're breastfeeding, so if you are having pain but you don't have an infection, everything's okay, then we can give you some stronger painkillers if you're having a difficult time. But generally speaking, the vagina has a very strong blood supply, which is a good thing and a bad thing. It's a bad thing because if you have a tear, then you can bleed quite a lot, so we have to put stitches. That's why we put stitches. But the good thing is that because it has such a good blood supply, it tends to heal quite quickly. So it's a bit unusual if you're having that much pain a few weeks after birth. Usually it's just for a few days after birth. So if you're still in pain, then you're welcome to come and we'll check and make sure everything's okay. Does PCOS end after giving birth? No. So PCOS is polycystic ovary syndrome. Some women have lots and lots and lots of little cysts in their ovary, which can make it difficult to ovulate. PCOS tends to have a genetic component. It's also related to weight. So if you're overweight, PCOS can be worse. So does pregnancy affect PCOS? Probably not. Yeah. So I don't think that, if you had PCOS before and you got pregnant, then in most cases the PCOS will still be there afterwards as well. But it's something you can check a few months afterwards with a scan to see if you have cysts in your ovaries. There are certain conditions like endometriosis that do seem to get better a bit after you've had a baby. But PCOS is not one that is statistically related to pregnancy in terms of improving. And then this lady says that she has some bleeding at 17 weeks and some cramps. What should I do? Definitely go to the hospital. Okay, so if you're 17 weeks and you're having pain and bleeding, then definitely go to the hospital. We need to see you and do an assessment to check what's going on, because sometimes, it could be that there's some bleeding on the placenta or something like this. So you definitely want to come and see the doctor. Take some paracetamol before you leave the house, and come and find us, okay? Because, most of the time at 17 weeks, everything is okay. The chance of losing the pregnancy at 17 weeks is really very small. Miscarriage usually occurs before 13 weeks. So if you're 17 weeks, the chance that anything is going to happen is still very small. However, if you're having cramps and bleeding, you definitely need to go to the hospital. Okay, so now I think we're coming on to the last bit. So this bit is about preeclampsia. So preeclampsia is a condition that occurs in around about 1 in 12 women when they're pregnant. What it means is that it's a syndrome that occurs usually in the last part of the pregnancy. So I said earlier in your pregnancy journey, we see you more frequently in the last few months of your pregnancy. That's because that's when the highest risk time is for developing complications such as preeclampsia. So preeclampsia is a problem with the placenta. When you get pregnant, the sperm and the egg come together and then the placenta starts forming inside the womb. So the placenta is the afterbirth. So if the womb is here and the placenta is here, they're supposed to bind completely. But what sometimes happens in women is the binding is not complete, and you end up developing problems where your placenta starts producing toxic substances. And these toxic substances, they leak into your blood, and then that can cause major problems. The major thing is it causes your blood pressure to be extremely high. So you get extremely high blood pressure, and all of that inflammation and pressure inside your kidneys causes your kidneys to leak protein. So you'll notice if you're pregnant, every time you come to the doctor, we take a urine test. That's because we want to check if you have protein in your urine. Because if there's protein in your urine and you have high blood pressure, it means that your placenta is having a problem, and it can be very severe. The symptoms of preeclampsia are things like headaches. So you get really severe headaches. So I always say to every woman that comes to my clinic at the end of every appointment, the 3 things I hate are headaches, bleeding from the vagina, or any baby reduction in the baby's movements. Yeah. So headaches can be a very serious thing in pregnancy. Now, if you've been at work all day and then there's a jam somewhere near Jacaranda Road or wherever you are, and you're stuck in traffic and you come home and you have a headache, sure, it's stressful, take some paracetamol, drink some water. If you're feeling okay, fine. If you know why you have a headache. But if you don't know why you have a headache in pregnancy, if it's really severe, sometimes your vision goes funny as well. If you have this problem in pregnancy, that can be preeclampsia, and you definitely need to get checked out. Because if you don't get checked out, then it will just get worse and worse and worse and worse. And actually, sometimes it can result in seizures. So you may have heard of pregnant women having full body seizures. And that's usually because their pressure has got so high inside their head, because their blood pressure is so high, that they have a seizure. And then the mother and the baby are both very much at risk at that time. So preeclampsia happens. Usually it's mild, we just need to know it's there and just manage normally. Sometimes it can be very serious with seizures and things like this. So if you're having headaches at the end of your pregnancy, come and check out. It doesn't happen in the first part of the pregnancy, it only happens at the end. But if you have like a really bad headache, your vision is funny, you're having swelling all over your body, you're feeling really unwell, then come and get checked out, because we need to make sure you and the baby is safe because of preeclampsia. But it's manageable, and because the problem is with the placenta, the cure is to take the placenta out. So that means taking the baby out too. Yeah. So the cure for preeclampsia is delivery. So you come to us, and if you have that problem, we make an assessment of what's going on, find out how the baby is, find how many weeks pregnant you are, and then make a plan to get a safe delivery in the setting of having these blood pressure problems. And we can give you lots of blood pressure tablets and things like that to bring your pressure down while we're waiting for you to have your baby. But it's a complicated story. Preeclampsia is many different things can happen, and so depending on what your symptoms are and what your blood tests are like, then if you come to the hospital, we can help you with those things. But just don't ignore bad headaches in pregnancy is the main piece of advice, particularly at the end. It's pretty bad if you ignore it. And so I think that's about it for preeclampsia. I think we have a few more questions, and then I think we are done, yeah? So how long can labour take to start after a membrane sweep? So a membrane sweep is something we do on your due date. So when you come on your due date and you say, hey, where's my baby? We can do a membrane sweep. This triggers your body to go into labour. It's like a natural way of making the baby come. Usually if you've had a stretch and sweep and 24 hours have passed and you've not gone into labour, that means the stretch and sweep has not worked. You can repeat it, or you can wait until the day of your induction. But generally speaking, when you've had a stretch and sweep, if it's going to work, it usually works within the first 24 hours. The next thing is it a must if I need to be induced if I have gestational diabetes? So the answer to that question is yes and no. So let's say you have gestational diabetes, which is really well controlled, and the baby's normal, and you're on no tablets and everything's perfect, then we can let you get to near your due date, and then we talk about induction. But it might be, because you can go into labour any time after 37 weeks. You might go into labour at 38 weeks in one day, or 39 weeks in one day. That's okay. If your sugars are perfectly controlled and your baby's growing well and everything's okay, we can wait in the pregnancy to close to your due date and hope you go into labour before that. But if you get to near your due date and you're still not pregnant, you're still not having delivered your baby, then definitely we think about induction, because we worry about stillborn babies. When a woman has diabetes, there's a higher chance of stillbirth, so we need to make sure that baby comes out in a timely manner. And then we have two more questions. I'm 9 weeks pregnant. Ultrasound shows I have a low intrauterine gestational sac. Please advise. So it depends on... lies. Look up, we're given more questions. It depends on what is in the sac. Yeah. If you have an ultrasound scan and it says the sac is low and the sac is empty, that is not fantastic. That might mean that you're about to have a miscarriage, but we can't be sure. When you do the scans and you identify a problem in the first part of the pregnancy, what you usually need is you have to repeat the scan about 10 to 14 days later to check for any difference. So I can't tell you based on this sentence of I have a low sac if that's a problem or not. Yeah. So unfortunately, when you've had a scan like this, you need to wait a few days afterwards, repeat the scan and check what's going on. But I hope everything's okay with you, but we just need to check. And if the baby's inside and the heartbeats are strong and everything's good, usually it's okay. So it just depends on what's inside the sac that we see. How many weeks is it advisable for an elective cesarean? So generally speaking, if you're planning an elective cesarean, it's done at 39 weeks. You don't do it before that time, because if you do it before that time, the baby can have breathing problems related to the surgery, unless we have to. So let's say you've got preeclampsia at 38 weeks, and you'd had a previous cesarean before, and you were waiting for your cesarean next week, but then you get preeclampsia when you're 38 weeks, then we have to do it at 38 weeks. But generally speaking, we try to wait until 39 weeks. And then I have one more question. I am 34 weeks and would like to know what causes low blood flow in the placenta and what I can do to increase this flow. So, that could mean many things. Low blood flow in the placenta is not a diagnosis, yeah? So if you've had an ultrasound scan that shows that there's problems with the baby's growth, or the Dopplers, which is the blood flow in the placenta, doesn't look totally normal, then the first thing to do is to make sure you've seen an obstetrician, like a senior obstetrician, and that they have a good plan for you, yeah? You don't want to look at that scan and go, oh, it says something's wrong, but I'll wait to see the doctor. Like, you need to see a doctor if your placenta is having problems at 34 weeks. There is no way to improve it, okay? Your placenta is fixed. It formed completely when you were 12 weeks pregnant, and then it just grew. So its connections and everything else that was established at 12 weeks, and now the placenta is just growing. But if there's something wrong with the placenta, it's been there for months, and there's no medication you can give to improve the blood flow. There's none of these sort of things. What you need, if the scan shows there's a problem with the placenta and you're 34 weeks pregnant, is to see a very good doctor to make sure that your plan is in place and that baby's going to be monitored well, and that you have plans for all the scans and things like this. Because many times in this situation, all we need to do is keep a close eye on that baby. But sometimes in this situation, we need to plan early delivery so the baby doesn't have a complication. I hope everything is okay with you and that pregnancy. Please come and find us if you have any problems. So I think that brings an end to this slightly unusual TikTok, because we covered a lot of topics and then we were bouncing around with questions too. But generally we do these things once a month, and we either just do a question and answer session where we just do questions and answers, or we do an education session. So the last education session was on preeclampsia, and there was also this discussion about doing one on ectopic pregnancy, but I wonder whether this counts because we've already talked about that. But if people do want any particular topics to be discussed at length, then please just message our marketing team, and then we'll be happy to do that next time we speak. So stay well, I hope you had a good Easter, and see you again.